It's springtime, so that means we have longer sunny days, warmer weather, a lot more energy when you step outside and enjoy your life. But a lot of people are saying, no, maybe not. They don't have the energy. And that's what is disturbing and what a lot of doctors are seeing. So right now, we actually have a doctor in here, and we're talking about low hemoglobin levels here. And so we wanted to speak with you, joining us right now about those symptoms, about being anemic and how to correct that is Dr. Michael Randolph. And you are chief of staff, right, at Union Memorial Hospital?
And I'm also in private practice for internal medicine.
Okay, well, thank you very much for coming in. So it's one of those things where we're seeing springtime. I mean, it's time to get out, run, play with the kids. I mean, go to the beach. We're starting to get used to that, and then but you're seeing more people saying, no, I'm just tired, I'm sluggish.
Right. Well, interestingly enough, that's a very common symptom that we see in the office, that people will present with just malaise and fatigue.
Right.
And a common cause of malaise and fatigue can be anemia. And anemia actually is low blood. And low blood typically is due to a low hemoglobin, which is the protein that's carrying oxygen in the red blood cell. So simply, anemia, as I said again, is low blood loss. It's three very common causes of how that happens. Usually people don't make enough red cells. Number two, people make enough red cells, but they're destroyed before they can replace them. And third, probably one of the more common things that we see is just simple blood loss. So for example, typical things of low blood loss would be bleeding from a wound, also such as bleeding from the GI tract or the urinary tract. And probably one of the most common causes is just simply female menstruation. In fact, there's about over 3 million people in this country who are female who are probably anemic, probably due to that.
Okay, and so now more females then, is this an issue for more females, or males need to be aware?
Typically, but also male. I actually have a patient, interestingly enough, who has had a history of gastrointestinal bleed. And in the past, he got blood and whatnot, and he came in back to see me in the office recently, and his complaint was malaise and fatigue. And so I'm thinking, you know, I took a good history. He doesn't have any obvious causes of rebleed. But interesting enough, I have to think, you know, perhaps this guy's bleeding again. And so that's where the technology comes in.
And that's what you have right here. Pronto 7 is the name of this technology. And this is really new. Instead of actually drawing blood from a patient, it's a simple inpatient, procedure right here. You don't have to wait.
This is a new technology, which is a non-invasive approach to checking your blood. Now think about the advantage of this. Typically, when someone gets their blood drawn, they have to get a needle. That's not a lot of fun. It's the old saying, no pain, no gain. Well, we can get a lot of gain with no pain. It's much easier to do that. All right, the second thing is that the results take a while to get back, all right?
From the traditional blood.
From the traditional blood. Patient comes to my office at 9 o'clock in the morning. I may not get the results back till later in the afternoon, late in the evening, or the next day. Okay, and so that's great. And the most important thing, it's non-invasive and very simply. So what we're going to try with you, we're going to do your blood count right now.
And we'll need to go right now. We're going to do that over the break. So what we're going to do is, it's real easy. I'm going to put my ring finger into this mechanism right here, and this will read the results, and then we'll share them with you after the break. Now, if you'd like to learn more about this, we're going to take your calls coming up right here. Our phone lines are open right now at 410-481-4545. You can also send us a tweet, any of the questions that you have right here for the doctor at Fox Baltimore, or simply go through our Facebook page. You're watching Fox 45 Morning News, all local, all morning. We're back with Dr. Michael Randolph, and we are taking some calls and some information here about low hemoglobin levels. And right now I need to stay still. I may have messed it up, but I'm taking a quick test, and we are taking your calls and questions about maybe if you have low hemoglobin levels. And right now we have Miss James from Hyattsville is on the phone. Miss James, you're on air with the doctor.
Yes, good morning to both of you. I'm calling because I was in the hospital on Friday. I was so depleted of energy, I could not function. And they told me that I just had a urinary tract infection, which as a female, of course, I've had that many times. And it's in no way related to what I'm going through now. I'm on medication, an antibiotic, but I'm still weak.
What's your question for the doctor?
My question for the doctor is, what can I do about my energy level?
Well, there's lots of causes for possibly why you may have low energy, for example. It could be that perhaps you could have low blood, but I imagine they checked that when you were at the hospital. I would recommend perhaps that you follow up with your healthcare provider and do some additional testing, because there are other diseases and other situations that might explain your low energy level or your fatigue.
All right. Well, thank you very much for calling in. We also want to go to Facebook page real quick. We have somebody that wrote in from Virginia, said, I am tired all the time and my body hurts all of the time. I stopped taking painkillers because they don't work. How can I boost my energy and stop the pain?
Well, again, there's a lot of different causes for having this particular symptom that you described. And again, I would recommend perhaps that you do follow up with your healthcare provider and spend some time with him and take the time to talk about all your symptoms, and I'm sure they will arrange for the proper workup to make sure hopefully they can find something that's treatable for you.
All right, now let's get right over to this Pronto 7 machine.
Okay, so what we're
going to
do, this is a very simple procedure. And instead of having a needle stick, what we would like to do here is to actually check his blood count without a needle. All right, and so essentially what you do is you align his sensor with his finger. You have to be still. And actually the sensor comes in different sizes, so you actually size up the proper one for the patient. After that, you have the patient just rest you usually have it where you are now, about heart level, just relax, keeping it still, and then we just simply push the button for the test.
And I'm going to move this just so you can see. Right there, that's working right now. Now, I did it before and I moved and it bumped me out, so I wasn't able to do it. And that was it, just because of my own fault. But normally, this would be a needle going into the skin.
Absolutely, and it takes about a minute. Now, the advantage of this is that I'm going to have these results back instantaneously. And right then and there, I can make the proper arrangement for the patient. God forbid if his blood is low, we'll find out shortly, Tom, that I have to have him go down to the emergency room and repeat the blood and perhaps get a blood transfusion.
And then we'll add some iron to my diet and I'll be good as new, right?
Let's hope so.
Let's hope so. All right, well, we need to go right now, though, but we will continue to follow up on this one, and I'll try and keep still. Thank you very much, Doctor. We appreciate that.